Welcome to EPG Pathshala. Myself, Professor Mini Sheth from the Department of Foods and Nutrition, Faculty of Family and Community Sciences, the Maharaja Sayaji Rao University of Baroda, will present a module on physical growth, physiological and psychological changes and the problems in adolescence. In trying to discuss the adolescence, most adults tend to confuse the terms adolescence and puberty and use them synonymously. However, puberty refers to the physiological changes involved in the sexual maturation of a child as well as other body changes that may occur during this period of time, while adolescence refers to the stage from puberty to adulthood and includes the psychological experiences of the child during this period. Adolescence is described as being the teenage years from 13 years to 18 years of age. However, puberty decides the onset of adolescence. Therefore, the adolescence occurs in some children as early as 9 years of age. During this period of time, the child has a great deal of concern over his or her body image, and any discrepancies in the child's eye such as obesity, early or late maturation, etc., may be manifested through a variety of disorders. During adolescence, there is a large degree of psychological growth as the children make adjustments in their personality due to the rapid physical and sexual development, which are the characteristics of this period of life. Adolescents face ongoing conflict and difficulty adapting to the sudden upsurge of sexual and aggressive drives. These changes cause unrest and confusion in adolescents' inner selves and in the way they perceive the world. Biological, psychological and cognitive changes that begin during puberty and continuing throughout the adolescence directly affect the nutritional status and nutritional needs of these children. Adolescents experience dramatic physical growth and development during puberty, which in turn appreciably increases their requirements for energy, protein and many vitamins and minerals. The increasing needs for energy and nutrients among adolescents combined with increasing financial independence, increasing in the need for autonomy when making food choices and immature cognitive abilities places the adolescents at nutritional risk. Therefore, it is vital that the healthcare providers who provide nutrition education and counseling have a thorough understanding of adolescent physical and psychological growth and development. After going through this module, you will be able to understand clearly the various stages of physiological development among the adolescents, learn the sexual maturity rating scale, which is important to gauge the degree of pubertal maturation, and identify the various theories of normal psychological and cognitive developments of adolescence. First, let us try to understand the physiological development of adolescence. Puberty refers to the physiological changes that the adolescent undergoes in order to reach sexual maturity. It is best characterized as gradual onset of mature reproductive hormonal activity, which is triggered by central nervous system, mainly the hypothalamus and the pituitary gland. Most people look at puberty in three distinct stages, such as the prepubescent age, pubescent age and the postpubescent age. The prepubescent stage includes the first evidence of sexual maturation, primarily the sexual characteristics, and terminates at the first appearance of pubic hair. During this stage, reproduction is virtually impossible. During the pubescent stage, growth spurt begins to accelerate. Males experience their first emission of semen, usually in the form of wet dreams, and menarche occurs in females. The post-pubescent stage is characterized by the declaration of the growth spurt, completion of both primary and sexual characteristics, and fertility is possible. Let us now look at the anatomical development of the adolescents. Adolescents' growth first centers on the extremities, the legs and the arms during the early stages of adolescence. Changes also occur in the facial configurations of both the sexes. The lower portions of the head begins to grow because the child lengthens and nose grows in width and or in length. Additional changes in proportion of the face is accredited to changes in tissue distribution. Even though both sexes undergo this change, within the females a layer of subcutaneous fat develops, which causes the rounding and softening of the contours of the face and the body. Whereas the male subcutaneous fat development is much less pronounced, but the development of muscles and bones in the face is clearly seen. This gives the males an inner, leaner and more angular face than the females. Changes that occur on the surface of the body in both the sexes. The most observable change is the growth on body hair, both pubic and axillary hair, and the development of the pubic hair is the first sign of a child ending the prepubescent stage and entering into a pubescent stage. This process begins about the same time as the growth spurt begins and is in the form of slightly coarse straight hair that grow at the base of the penis and at the labia majora. The growth of the pubic hair continues throughout the adolescence and it spreads horizontally, then vertically until it surrounds the genital areas. Characteristically, the pubic hair becomes longer, thicker and darker and kinkier as it spreads over the genital areas. In males, the growth of facial and chest hair may be pronounced and tends to represent virility in the eyes of the adolescent. Noticeable chest hair with thickness in the texture does not usually appear until the post-pubescent stage and continues to grow during the manhood. Facial hair usually appears in the form of dark shadow above the lip, and then it appears on the chin, along the jawline, and then develops along the neck. Females may also find small amounts of facial and chest hair. Both the males and the females' skin undergoes changes such as becoming coarser with sebaceous glands, becoming more active, producing oily secretions which usually help cause acne and blackheads. Sweat usually causes an odor in adolescents because the chemistry and the composition of sweat is altered by oils that the sebaceous glands emit. Adolescents also show an increase in their blood pressure and decrease in both basal metabolic rate, the rate at which the body in a resting state consumes oxygen, and in the pulse rate too. Now, let us look at some of the signs of the sexual maturation in male adolescent. Even though the male adolescent's growth rate varies from child to child, a sequential pattern has been identified. The typical sequence of events occur as follows. Whereas the sexual maturation of the female adolescents show different signs. Now let us learn about the menstrual cycle of the females. The menstrual cycle is controlled by the hypothalamus, which acts as the menstrual clock. The clock operates through pituitary gland located at the base of the brain. The pituitary gland cyclically secretes two hormones which directly stimulate the ovary, and these hormones are follicle stimulating hormones and luteinizing hormones. The growth and activity of the follicular cells result in the secretion of estrogen by the cells, and this hormone is found in the fluids of the follicle, whereas the luteinizing hormones cause the cells of the follicle to rupture and expel the ovum. Then the fluids in the cells form a new structure called the corpus luteum. The corpus luteum is stimulated by gonadotropins and initiate the production of hormones progesterone. Progesterone causes the lining of the uterus to change, thus getting it ready for conception, embedding and gestation of a fertilized ovum. The coordinated action of progesterone and estrogen makes the lining of the uterus an environment where an embryo can survive during pregnancy. Menstruation occurs approximately every 3 to 4 weeks. If the ovum is not fertilized, most of the lining of the uterus mixed with blood is expelled through the cervix into the vagina. This bloody discharge is referred to as menstruation or menses or menstrual period. The entire cycle repeats itself with regularity throughout the reproductive life of the female. However, at its onset after puberty, menstruation may be irregular for up to a year or two. There may be a great deal of deviation in the age of onset, duration and tempo of these events between and within individuals. And for this reason, adolescents of the same chronicle age can vary greatly in physical appearance. The nutritional requirements in this age are affected by the stage of maturation in both the boys and the girls. A 13-year-old male who has nearly completed the linear growth spurt associated with puberty has experienced significant muscular development will have remarkable different energy and nutrition needs than those of a 13-year-old male who has not yet experienced puberty. Consequently, the sexual maturation should be used to assess the extent of biological growth and development and individual nutritional needs of the adolescents in place of chronological age. The sexual maturation rating, also known as Tanner staging, is based on a scale of secondary sexual characteristics that permit the health professionals to gauge the degree of pubertal maturation that has occurred amongst the adolescents, regardless of chronological age. This scale is based on the appearance of pubic hair, the development of breast, and the occurrence of menarche among females, and on the degree of the testicular and penile development and the appearance of the pubic hair amongst males. On the basis of this, there are stages of the development. The SMR stage 1 corresponds with prepubertal growth and development, where stages 2 to 5 indicate the progression of puberty. By SMR stage 5, the sexual maturation has been completed. Sexual maturation correlates remarkably well with the linear growth, changes in weight and body composition, and also the hormonal changes. There appears to be ethnic and racial differences in the initiation of sexual maturation. The linear growth may be delayed or slowed among females who severely restrict their calorie intake. Approximately half of the maximum adult bone mass is accumulated during adolescence, and by the 18 years of age, more than 90% of the adult skeletal mass has been accrued. Many factors play a role in the accumulation of bone mass, including genetic potential, hormonal fluctuations, weight bearing exercises, cigarette smoking, alcohol consumption, and intake of vitamins and minerals such as vitamin D, calcium, phosphorus, boron, and iron. It should be noted that more than 1/3 of the adult bone mass is thought to accrue during and immediately following puberty. After adult height is achieved, the accumulation of significant amounts of additional bone mass is unlikely. Now, let us try to understand about the changes in weight and body composition during adolescence. After approximately half of the adult ideal body weight is gained during adolescence, peak weight gain follows the linear growth spurt by 3 to 6 months in females and by 3 months in males. Girls generally will gain approximately 8.3 kgs per year during the peak rates of weight gain, and average weight gains during puberty amongst females is between 7 to 25 kg, with the mean gain of 17.5 kg. Weight gain slows around the time of menarche but will continue in the late adolescence. Adolescent females may gain as much as 6.3 kgs during the latter half of adolescence. Adolescent males gain an average of 9 kg per year during puberty, and the overall male teens gain 15 kg of weight during puberty with a mean gain of 23.7 kg. Body fat levels decrease amongst the males during adolescence, dropping to an average of 12% body fat by the end of puberty, whereas the body composition changes more significantly amongst the females during puberty. The average lean body mass of the teen females falls from 80% to 74%, while the average body fat levels increase from 16% to 27% by the end of adolescence. Females experience a 120% increase in body fat during puberty. On average, teen females acquire approximately 1.1 4 kg of body fat mass each year during puberty. While the accumulation of the body fat mass is normal, physiologically essential process, adolescent females often view it with negativity. Weight dissatisfaction is widespread among teenage females, leading to an increased risk of health compromising behaviors such as excessive calorie restriction, frequent dieting, use of diet pills or laxatives, and severe body image distortion and eating disorders. Now, let us look at the normal psychological and cognitive development. During adolescence, teens develop a stronger recognition of their own personal identity, including recognition of a set of personal, moral and ethical values and greater perception of feeling of self-esteem or self-worth. Psychological and cognitive development is best understood when divided into 3 periods: the early adolescence, that is the age of 11 to 14 years, the middle adolescence, that is 15 to 17 years, and the late adolescence, that is 18 to 21 years. Each of these distinct periods of development is marked by the mastery of new emotional, cognitive and social skills. Going on to the psychosocial development during adolescence, the biological changes that occur during puberty can significantly affect the psychosocial development. An increased awareness of sexuality and a heightened preoccupation with body image are fundamental psychosocial tasks during the adolescence. Dramatic changes in body shape and size can cause a great deal of uncertainty amongst adolescents, especially amongst females, leading to the development of poor body image and eating disturbances or disorders if not addressed by the family and the healthcare personnel. Similarly, a perceived delay in sexual maturation and biological development, especially amongst males, may lead to the development of poor body image, lower self-esteem, and therefore it is imperative that the health professionals who work with adolescents have a clear understanding of how a normal psychosocial and cognitive development relate to biological growth and development, and are able to appreciate how these processes affect nutritional intake and status. Peer influence is also one of the dominant psychosocial issue during adolescence, especially during the early stages. Young teens are highly cognizant of their physical appearance and social behaviors, seeking acceptance within a peer group. The desire to conform can influence food intakes among teens. Focus group comprised of adolescent females have revealed that food is divided into 2 classification groups: the junk foods and the healthy foods. Eating junk foods, according to these focus groups, was associated with being with friends, having fun, gaining weight and guilt, whereas eating healthy foods were associated with family meals and home life. Obviously, the teens adopt or develop food preferences and make food choices based on the associations with feelings of being accepted and having fun with peers, and may use food as a way to exert independence from families and parents. The broad chronological age range during which the biological growth and development begins, advances can become a significant source of personal dissatisfaction for many adolescents as they struggle to conform to their peers. Males who enter puberty at a later age may consider themselves to be late bloomers and may feel physically inferior to their peers and mature than those who mature earlier. This sense of dissatisfaction may lead to the use of anabolic steroids and other supplements in an order to make an effort to increase the linear growth and muscle development and also to weight gain. Such dissatisfactions can also lead to marked reduced self-esteem. For females, however, it is often the early maturation that is associated with poor body image, poor self-esteem, frequent eating, and possibly disturbed or disordered eating behaviors. Early maturing female teens are also at increased risk for engaging in other unhealthy behaviors such as smoking, alcohol consumption, and early sexual intercourse. Young adolescents should be educated on normal variations in initiation and progression of biological growth and development in an effort to facilitate the development of positive self-image and body image and to reduce the likelihood of early initiation of health compromising behaviors. Now, let us look at the cognitive development. The early stage of adolescence is a time for great cognitive development too. At the beginning of the adolescence, cognitive abilities are dominated by concrete thinking, egocentrism, and impulsive behavior. The ability to engage in abstract reasoning is highly not developed in most adolescent teens, limiting their capacities to comprehend nutrition and health relationships. Young adolescents also lack the skills necessary to problem solving in an effort to overcome barriers to behavior change and ability to appreciate how the current behaviors can affect future health status. Middle adolescence is characterized by growth in emotional autonomy and increasing detachment from family. The bulk of physical growth and development is completed during this stage. However, body image concerns may continue to be a source of trepidation, especially amongst males who are late to mature and females who have experienced great changes in their body composition and size. Conflicts over personal choice, including food choices, become increasingly common during this stage of adolescence. Peer groups become more important than family and their influence with regards to making food choices. Coinciding with the increased importance of peer acceptance, the initiation of health compromising behaviors such as smoking, alcohol consumption, using street drugs, and engaging in sexual activities often occur during middle adolescence. Teens may consider themselves invincible and often still display impulsive behaviors. Abstract reasoning skills begin to emerge among most teens during the middle adolescence. However, these skills may not be highly developed. Adolescents will often regress to concrete thinking skills when faced with overwhelming emotions or stressful situations. The teens start to comprehend the relationship between existing health behaviors and future health status, but their desire to fit in with the peers may make it difficult for adolescents to make health-related choices based upon knowledge rather than peer pressure. In the late stage of adolescence, it is a stage that is characterized by a development of a strong personal identity. The biological growth and development has concluded among most teens and body image issues are less common. Older adolescents are able to manage increasingly sophisticated social situations and are able to suppress impulsive behaviors and are less affected by peer pressure. Economic and emotional dependence upon a family is markedly decreased and conflict over personal issues such as food choices also decrease. Relationships with a single individual become more influential than those with a group of peers as a stronger sense of personal identity emerges. In this age, the expansion of abstract reasoning skills continue to occur during the late adolescence, which assist teens in developing an ability to comprehend how current health behaviors affect long-term health status. This is an especially important skill for adolescent females who plan to have children or who become pregnant during the adolescence. Older teens are now capable of learning problem-solving skills that can assist them in overcoming barriers to behavior change. So, what are the implications for nutrition intervention in adolescence? Because adolescent is a time of tremendous biological, psychological and cognitive growth and development, nutrition interventions need to be tailored to the developmental level of each individual adolescent. Health professionals should allow adequate time during the first session with the teen to determine his or her degree of biological maturity and level of cognitive development. These characteristics should be used to determine the individual nutritional needs and the type of educational messages that are given when counseling the adolescent. Hence, to summarize this topic, knowledge on physical growth and physiological and psychological changes and problems in adolescence can have a great positive implication on the health of the adolescents. Also, learning about sexual maturity rating scale, which is important to gauge the degree of pubertal maturation, can overcome the fear of early and late maturations in adolescence. Thank you.